It's Thursday. I've been out of pills for 3 days. I've cried most of the day. 2 hours of sleep again last night, maybe three and change. The pills at least give me hope. They give me 3 or 4 hours instead of two. They give me something. Yesterday, I got groceries and couldn't look the meat counterman in the eye. It was too much, and he wanted to look me in the eye. To hold the wrapped and bagged turkey aloft, to look me in the eye. It was painful among so many people, the chaos of energies under fluorescent lights. I kept my eyes down while the cashier rang up my turkey and diapers and the burritos Sean likes. I kept my eyes down while she handed me my change, tried to exchange pleasantries. Don't look into the garden of my suffering. I can't take it. Please, don't look. That selection was read from a great book I've read recently called Blood Orange Night by Melissa Bond. And it's a story of a woman driven to the edge of madness due to insomnia, Ambien controlled release, and Ativan, which is a benzodiazepine medication. So today, we're going to discuss the differences between sleep herbs and sleep meds. So I want to talk to you a little bit more about Melissa's story. It's really good. She basically is pregnant, and she gives has two childbirths right in a row, and one of her children has a Down syndrome, so it's a special needs child who's more than a handful. And basically, she has really poor sleep, and the first time she goes to the doctor for the sleep, they all say, well, you're pregnant, so we can't give you anything. Just try to rest, try to meditate, that sort of thing. And then she gets desperate. When she's down to 1 or 2 hours of sleep, she gets desperate. Finally, a specialist recommends Ambien. Ambien is probably the most common sleep medication in the United States. And Ambien, CR means it's control release, so it's released over time. And the doctor or nurse practitioner said that this is safe for she was pregnant, this is safe for your nursing baby or your baby. And you can combine that with 2 Benadryl. Benadryl is an antihistamine, which helps people fall asleep. So the prescription to help her sleep was Ambien CR plus 2 tablets of Benadryl before bed. And guess what? It worked quite well for about 4 weeks. And then instead of getting 5 to 7 hours of sleep, she started getting 3 or 4 hours of sleep. She continued on the Ambien CR and the antihistamines all before bed. And gradually over time, her ability to stay asleep went down and down and down. So at the point when she was taking Ambien CR plus 2 antihistamines per night and was only getting 2 hours of sleep, she made a prescription. She made a visit to another doctor, and that doctor said basically, "Oh, no wonder you can't sleep. Ambien's not a good drug. What you really need is Ativan, and Ativan's a perfect drug," the doctor tells her. And so she starts taking Ativan, and guess what? She goes to sleep. And guess what? After about 4 weeks, she needs a higher dosage to get, 3 or 4 or 5 hours of sleep a night. And so guess what? Many months later, the higher dosage of Ativan, she's only sleeping a few hours of sleep a night. And the passage I read to you was when she ran out of sleeping pills, or she was trying to go off the sleeping pills. So she wasn't using sleeping pills. She was using a benzodiazepine or a benzo, which is Ativan at night. And so one of the things that we want to look at is, so what are the differences really between sleep drugs and sleep herbs? Well, one of the advantages of sleep drugs is they are fast acting. And most people find that they can take a drug like Ambien or even Valium, which is a benzodiazepine, or Ativan, and it will help their sleep. It'll help them go to sleep. Now, what you may not know, and most of the doctors prescribing these drugs don't know, is that number one, the sleep is typically not a great sleep. So a person, also the clinical studies show that a person, yeah, they sleep, but it's only like 20 minutes, 40 minutes, 60 minutes at most compared to if they didn't take any medication. I want to say that again. These sleeping pills in clinical studies are only shown to increase sleep 20, 40, or 60 minutes. It's not like the person was getting 2 hours of sleep. They take Ambien and all of a sudden they sleep 8 hours. That's not what the clinical studies show. The other thing is while these drugs are fast acting and very effective, they become addicting and habit forming after 2 to 4 weeks. And so, and it could be that some people consider the benzodiazepines like Xanax, like Ativan, which Melissa was on, to be more dangerous than getting off heroin. Experts, there's a Ashton manual, and I believe the woman, she's a doctor in the UK, and I believe her name is Heather Ashton, Ashton. And if you really have a friend or family member or even a health professional that's hooked on benzodiazepines, I suggest the Ashton Manual. So the Ashton Manual talks about the fact that this is a doctor, this Dr. Heather Ashton has devoted her life work to pointing out the dangers of benzodiazepines and suggesting how people can get off of benzodiazepines. So the drugs are fast acting, they work very consistently, and after about 2 to 4 weeks, they become more addicting and habit forming. And that's not to mention the side effects. So we've had patients at the Get Well Clinic that have taken these drugs like Ambien, and what they start doing is late night texting, and they text friends, and all of a sudden, and the friends get these texts at the middle of the night and go like, that doesn't even sound like you. That sounds like a crazy person. Or sometimes they take Ambien and start eating during, they get up and they sleep eat. And then the most dangerous, and this has been in the news repeatedly, people take Ambien and go for a drive. And I believe that was the case with Melissa. One night she couldn't sleep, so she went, she was about to go for a drive, and then I guess her husband stopped her. But people don't even know that they're sleep driving, and so that's really dangerous. So let's just look very quickly about what are the standard side effects of Ambien, which again is a very popular generic sleep medication in the United States. Daytime drowsiness, dizziness, feeling drugged or lightheaded, headache, diarrhea, or feeling tired. So people take Ambien, and many times they don't feel better. They feel terrible the next morning. Some people take it, feel good, but that's typically people are just using it short term. So now let's look at sleep herbs. One thing, and this is a story I'd like to tell you. So one time I gave a talk to a group of acupuncturists about sleep herbs. And one acupuncturist called me up and was totally irate. She goes, herbs don't work, for sleep. And I go, oh, well, that's not been my experience. My experience is if you use herbs during the day and at night, I have something like a 90-95% success rate for people who, do a whole program, which includes sleep hygiene. And she goes, yeah, didn't work for me. And come to find out that this acupuncturist was on Ambien for 10 years, and she was totally dependent on it. I guess it suited her okay. She reports that as long as I take it every night, I sleep okay. But my prediction is one day the Ambien will stop working. And that's exactly what happened to Melissa. The Ambien stopped working, so then she switched to Ativan and then increased the dosages of Ativan. And even then, her body got used to it and she didn't sleep. So the sleep herbs work more slower, and they have less consistent effects. And this is why one person goes, wow, cannabis is the only thing that helps my sleep. The next person says, oh, kava kava works great for my sleep. And the next person goes, the best thing is valerian, right? So if you do use herbs rather than drugs for sleep, you need to be prepared to either see a health professional who's an herbalist, or you need to be prepared to experiment. I'm more in favor of one herb sleep formulas, or at the most 2 or 3 herb sleep formulas. I'm not a very big fan of these kitchen sink sleep formulas, but some people swear by them. And I would say that if it works for you, keep taking it. But in general, if you're new to herbs, sleep herbs, you want to maybe just try one at a time and see if that works for you. And then you select what worked for you. Also, I want to point out that if you are like the acupuncturist who's been taking, Valium or Ambien for 10 years, you're not going to be able to stop taking Ambien and then just transition to herbs. Melissa is one of the people who had to titrate very lowly. She had to get off Ativan and get on Valium, and then slowly titrate the Valium dosage downward. And it took Melissa about six months to 12 months to get from 60 milligrams of Valium, which is a huge whopping dose, to down to something like 5 or 10. And even then she could get off 5. So if you do take sleep drugs, my suggestion, and you want to get off them, is you do so very slowly. You see an acupuncturist who specializes in herbs. And the reason I recommend that is the acupuncturist, especially if you go a few times a day, can help regulate the body's energy. And then a really good acupuncturist herbalist, can select one group of herbs during the day, which works on your constitution, and another group of herbs which you take at night, which to help you sleep. So let me just tell you about a few other clients. One of the clients we also saw at the Get Well Clinic was a doctor who said he hadn't slept since medical school. And I said, well, surely you're sleeping a little bit. And he says, maybe I sleep 20 minutes a night. I don't know. I asked a colleague of mine who specialized in sleep, I said, is that possible? He said, the doctor probably gets 1 or 2 hours a night. He's just not aware of it. And we worked with the doctor with acupuncture, one set of herbs during the day to work with his constitution. And we used actually 5-hydroxytryptophan, which is a natural occurring type of tryptophan. And he started saying for the first time, he started getting, a couple hours of sleep at night. And that gradually increased, although I think the maximum he got to is about 4 or 5 hours a night. And then another patient we saw was a nurse. Her name is Mary, and she had poor insomnia due to menopause. So in this case, she was a nurse, so she did not want to take pharmaceuticals, but she kept waking up all the time. So we selected one group of herbs which helped her constitution and her menopausal symptoms. And then we also had her take herbs before bed. And I think the overall treatment for Mary took about a month or two, but she said, yeah, finally I'm sleeping a couple hours. And then if I wake up, I take the sleep herbs you recommended, and then I fall right back to sleep. And I think the doctor who didn't sleep, I think, again, it took him about 6 months to get from no sleep to about 4 or 5 hours of sleep a night. This concludes our podcast for today. If you'd like to see more videos like this, please comment below and let us know what topics you'd like to hear about. And be sure to like and subscribe to help us grow our channel. If you'd like to know more about us, please visit our website at getwellfoundation.org. Thanks for joining us, and we'll see you next time.